which is a very key one, and we are really looking forward to having these discussions today and seeing how we can contribute further to the EU strategy on the aging. The Red Cross EU office, which brings together 27 national Red Cross societies in EU, which is the Norwegian as well as the Norwegian and Icelandic Red Cross and the International Federation of Red Cross and Red Crescent Society, is really happy to share this platform with AGE to promote the very important topic of aging and long-term care in Europe. So we're very pleased to have this very close collaboration with AGE platform. We are equally happy that we have the opportunity to discuss the long-term care in Slovenia in particular, which includes both the perspective of older people and service providers. And that this discussion occurs in the presence of representatives from the European institution, which makes this workshop an occasion to contribute to building a stronger European care strategy. The Red Cross believes an aging population provides countless opportunities, and that when older people are supported to age in a healthy way and are socially included, we can continue to contribute. They can continue to contribute to their family, friends, and communities. As auxiliary to the national governments, the 27 national societies in Europe run programs and services that respond to the specific health and social needs and risk among older population. Delivered at community level, they support older people to remain in their communities, but also to be included in their communities. Crucially, our work also focuses on empowerment and promoting human dignity, with an emphasis on tackling discrimination, stigma, and ageism, while promoting intergenerational solidarity. We feel that this event is timely, in particular as the European Commission prepares to develop the EU care strategy, ensuring that everyone has the right to affordable long-term care services of good quality, in particular home care and community-based services, as outlined in Principle 18 of the European Pillar of Social Rights, is central to the well-being and social inclusion of older people. In our contribution to the Green Paper on Aging, we recommended that the European Commission adopt a life cycle approach through the promotion of active aging policies from an early age through voluntarism across the life cycle, while strengthening awareness and pre-learning amongst children and young people to promote healthier lifestyle choices to ensure healthier and improved quality of life in old age. It is important to promote the social inclusion of older people, recognizing the value, strength, and virtue of each individual, no matter the age, to facilitate interaction as a way to fight loneliness and promote good mental health in the older population. It is also crucial to strengthen community-based services for older people. For example, providing information and technical training for family members and the community, as is the case for the Slovenian Red Cross. Moreover, we also recommend greater access to quality long-term care with a focus on integrated care models to support older people to stay and live longer in their homes and their communities. We cannot talk about aging and long-term care without also mentioning the devastating impact of COVID-19 that COVID-19 has had and continues to have on older people and their families. Older people have been one of the most affected groups in terms of high mortality, but also poor mental health, isolation, and loneliness due to lockdown measures. There needs to be a paradigm shift, both in terms of how we care for older people, but also how we can innovate care. Since the state of the pandemic, national societies have been stepping up their efforts to support older people at home and in their communities through regular monitoring and assessment of needs and regular outreach and delivery of integrated services. Moreover, we have sought to provide digital support to older people at risk of loneliness and isolation through the provision of digital skills and computers so that they can stay connected with their families and community. Finally, the European Pillar of Social Rights and the EU Green Paper on Aging represents the EU's commitment to addressing aging in long-term care across all member states. In this sense, the EU funding represents a unique tool to implement Principle 18 of the pillar and leave no one behind if it is invested fully in community-based services. The Red Cross, thanks to its presence within the local community it supports, has for a long time committed to ensure the social inclusion of older people and to create and adapt community-based services to meet their needs. We will continue this commitment and seek to reinforce partnership with the EU, member state, and like-minded organizations to ensure quality and integrated care for older people as a priority to guarantee this respect and human dignity at all ages. And this is why this meeting today is very crucial as an important step in that direction. Again, we are glad to co-host this event with Age Platform, with which we share deep commitment when it comes to aging and older people. And I'm glad to leave the floor now to the Secretary General of Age Platform, Mr. Maciej Kucharuk. I'm sorry if I didn't pronounce the name correctly, but over to you, Maciej.
Thank you very much, dear Mette. No worries. I'm, how to say, I know how difficult my family name is, so absolutely this is not a problem. Great pleasure, ladies and gentlemen, dear colleagues, friends. Good morning, first of all, to all of you. It is with pleasure, but also I would say with hope, that I co-open this seminar on care and support for older people. The pleasure that goes, it's self-evident, considering first of all the outstanding speakers that we have, but also the great number of participants that are around the table today. But at the same time, as I said, my hope is that today, all of us around this table, we will have the opportunity to, why not, to question, to change actually the discourse, the current discourse on care, and ultimately to impact policymakers who I believe should reform the current systems of care and support at national level, but also, of course, at the European level. We all know that the pandemic has only sadly demonstrated how wrong and inadequate the current care system are, and this is why there is a need for a change. At Age, we believe that strong care and support, they are actually the solutions. In other words, if they are properly organized, founded, and monitored, they can empower older people in need of care. We've been already for a while in this internal reflection at Age about how we would like long-term care to look like. But of course, to do this, first of all, we need to move away from a focus on vulnerability, on dependence in long-term care, and move to approaches which are based on autonomy and empowerment. This is, by the way, an explicit request that comes from other people. As I said, over the past months, we've been discussing this new vision for care, and we asked in these discussions how actually our members, they were asked what they would compare care with. And the result was, I would say, quite unequivocal. Here, I will actually share with you a screen with an image which actually presents care as a metaphorical tool. Let me just to share the screen with you. Here we go. So as you can see, this image shows actually how rich the understanding of our members of care is. Actually, care here is depicted as a set of objects, meanings, which are very dynamic, positive, empowering. We speak here about actually choice, diversity, about empowerment, about solution. So all those different objects that we can see on this image, I do believe they translate all this potential that care actually has. But of course, we know how far we are from the vision of care, which would translate what we are just now looking at the screen. So I do believe, I hope that our workshop today actually will be guided by this comprehensive vision of care, and that this is something which will inspire all those who we have invited to this discussion. In preparing our online workshop with colleagues from the European Red Cross office, from the Slovenian Federation of Pensioners Associations, as well as the Slovenian Red Cross, we also wanted to provide inspiration for building a case for a strong European care strategy. And eventually, we believe that this, because we are convinced that such a strategy should underpin, support, and inspire national reforms. It was already mentioned by Mette, the announcement by President Ursula von der Leyen of a European care strategy. It creates a momentum that we wanted actually to seize today. The workshop will be built around two consecutive and complementary panels. The first one will present the Slovenian case for long-term care. So we hope that this will provide not only the insights into into the ways care and support services are organized and delivered in Slovenia, but also that this panel will emphasize the realities and aspirations of older people. And then we will move immediately in the early afternoon to a second panel, which will address actually the role of the EU. So what can be done, how at the European level, how the EU can bring in terms of, I would say, proposals, recommendations, what kind of orientation can be actually created at the European level to orient, to guide national reforms. So here again, I already mentioned the momentum created by the announcement of the work to elaborate a European care strategy. We need such a strategy which will be ambitious, but first of all, a strategy that will inspire member states to improve the national care systems, so they are eventually based on human rights, on the notions of quality, accessibility, universality. But also we believe that care systems should empower their recipients and at the same time offer high quality working conditions and necessary support for carers. Of course, the EU does not have a strong competence in care, but we believe that the European Union has a strong potential to set the tone. Sorry, I will just stop sharing, right? And therefore, our workshop today will conclude with a short wrap-up session where we'll come with some key findings and takes away from the discussion. The ambition is that we will actually with the recommendations of this workshop, hopefully we will feel at least partially the gap in the ambition on what care is about and how it should be improved. For your information, there will be, of course, a joint report by Age Platform Europe and the EU, the Red Cross EU office. So this is something which will follow. So there will be a record of all the discussions. And I do hope that, again, as I said, this workshop will be just a starting point for further work towards a new vision of care which supports and empowers older people. Ladies and gentlemen, once again, a very warm welcome to all of you, and I'm handing over to Ronan Mangan, who will moderate the first panel on the Slovenian case. Thank you very much for your attention.
Thank you, Maya. Thank you, Meta, and good morning, everyone. My name is Ronan Mangan, Head of Social Inclusion Unit with the Red Cross EU Office, and I'm absolutely delighted to moderate this first session of our event this morning. Now more than ever, long-term care is vital for making sure that older people are able to always live rich, active lives, no matter how their health and social needs may change with time. As the population in EU member states continue to age rapidly, understanding how to create quality long-term systems, but also importantly services which place the needs of older people at its center is of great importance. As the EU now looks to address the issue, it's important that they're able to support member states based on what works for older people in the long term. The objective of this morning's first panel discussion is to have an overview of long-term care in Slovenia and to touch on those points in relation to how, based on needs, the EU can support member states. The overview will be built on three important perspectives: the perspective of policymakers, the perspective of older people, and as well, of course, the perspective of service providers. In building on these three perspectives from Slovenian case, we'll be able to touch on how the EU can support advancing long-term care reform at the national levels. To join me in this discussion, I'm delighted to introduce our panelists. Ms. Tanya Skornsek-Plez from the Ministry of Labour, Family, Social Affairs and Equal Opportunities in Ljubljana, Slovenia. Good morning. Ms. Rosvita Svensek from the Slovenian Federation of Pensioners Associations. Good morning. And Ms. Silva Dud from the Slovenian Red Cross. Good morning, panelists. If I may start our discussion, because I know we're quite pressed for time, and I think we have a lot to touch on as well. So if I may start our discussion by asking you, Ms. Skornsek-Plez, can you give us an overview of what your government's priorities are in the field of long-term care?
Thank you. First, I would like to greet all the present and thank the organizers to give us opportunity to take part in this workshop. So thank you very much for your invitation. In the beginning, I would like to say that long-term care as services for elderly in general are obviously in focus of the work of our ministry, but for the last year and a half, due to the COVID crisis, are also in the focus of a wider social debate, and it's quite a discussion going on in Slovenia about the long-term care, also in the aspect that right now in the National Assembly, there is a proposals of long-term care act in the procedure of being adopted. At the beginning, it is necessary to say that Slovenia currently does not have a comprehensive system of long-term care. Currently, the rights to services and cash benefits for the people that depend on some others' aid are defined in various legal acts, at least 6 legal acts to be more precise. There are no uniform criteria for determining needs and procedures for determining the line for the entitlement to individual rights. The level of assistance an individual receives is not always in the line with her or his needs. Access to services differs significantly between those in the institution and those who choose to stay at home. And it's estimated that the whole area is very fragmented, not transparent, and generates inequality between users, both in terms of organization and funding. So the proposal of the Long-Term Care Act envisages the establishment of a long-term care system as a new pillar of a social security, which will enable and assure the provision of long-term care as an integrated activity in connection with changes in other social securities. I'm talking about health, social security, and pensions protection. As one of the sources of financing long-term care, the proposal of the Long-Term Care Act envisages financing from compulsory long-term care insurance, which provides universal rights accessible to all beneficiaries under the same conditions. The range of long-term care services includes services in the field of basic daily tasks, supportive daily tasks, nursing care relating to basic daily tasks, services for maintaining and strengthening independence as an important segment of strengthening the individual for the highest level of self-care or prevention of higher needs. So the government's priority is the adoption of the Long-Term Care Act, through which the following will be implemented. First, defining the content and scope of rights and range of long-term care services. Second, the establishment of a single evaluation mechanism for entry into the long-term care system. The creation of a comprehensive, universally accessible, geographically and financially sustainable and achievable I'm sorry, my tongue is messing. Then the fourth point is to allow the beneficiary who wishes to do so to stay at their home environment for as long as possible, of course, with appropriate assistance. Managing the growing private funding of individuals, which increases the risk of poverty, especially among the elderly. Improving the planning, management, and assurance of the quality, safety, and efficiency of long-term care as a public service. And finally, the establishment of effective public oversight in the field of long-term care. So this is like the priority of this government in the field of long-term care.
Thank you, Tanya. I think that's been a very honest appraisal of long-term care in Slovenia as it currently stands, not negating the fact that you mentioned a number of measures which are being undertaken to both improve access, but also to reduce the fragmentation of service, which I think is probably an issue in many member states. Maybe if I could turn to Roswitha and Silva. So based on what we've just heard from Ms. Skorncek, I'm wondering from your perspective, what you feel are the main aspects that need improvement in Slovenian long-term care support, care and support system. So maybe I'll start with Roswitha, because I see you just beside my image.
Hello to everyone. We just heard from Tanya that there is currently no comprehensive long-term care system in Slovenia, unfortunately. And it's spread between services, long-term care benefits and funding are covered by the healthcare, social and parental protection, pensions and invalidity benefits. And each of those forms are covered by specific legislation. Long-term care includes benefits in the form of services and cash receipts. Care providers may be public or private by means of a concession to finance services from public funds. The long-term care law is under discussion these days, and the discussion is very hard and warm. This will regulate the financing on long-term care and the supply of these services. The reform foresees the creation of a single entry point, a single professional procedure for assessing long-term care needs, individual care plans, training measures for informal caregivers, and a greater emphasis on prevention and rehabilitation. We hope that this law will also cover personal assistance for people with disabilities who are entirely dependent on another person, which now this is not the case, but we hope that it will be. The cost of long-term care can be very high for individuals and likely to be one in need of long-term care. It is especially great in people from groups with lower income. Lasting solutions to finance long-term care will therefore contribute to reducing the risk of poverty. It should also be noted that the most unpaid long-term care, which relies on many families, done by women. There are opportunities for these women to get paid employment markedly reduced. This would provide effective, affordable long-term care, contributed to the second objective of the social investment package, improving women's access for formal employment. We are fighting very hard for the law to live up to people's expectations, and we hope that it will be. Thank you.
Thank you, Roswitha. Maybe if I could turn to Silva and ask Silva from a services perspective.
So we're working on maintenance. We received the assets from.
Sorry, excuse me. Someone has their microphone on. If they could kindly turn it off.
Yes.
Thank
Hello.
you very much.
Hello to everybody. Also, in the name of the Slovenian Red Cross, I would like to say that we actually agree with what both my previous speakers from the Ministry of Labor and Mrs. Roswitha from the Pensioner Union said. About this, we were discussing, and we are permanently, let's say, following the problem situation here on this field. First, I would like to say that we cannot generally speak, let's say, that everybody is bad in our long-term care system, because we have, let's say, very good nursing homes, which offer quite high quality of different services. But the fact is that there are not enough of them, and that they have a lack of people who take care of the beneficiaries in these nursing homes. And actually, also due to this and due to the financial, let's say, aspect, they don't have always the access to all the services they would need normally. So on the first place, what we see, there is a gap in capacities and demand on institutional care. And then there is a lack of awareness and consideration that the user is not only a patient, but also a psychosocial support, needs also psychosocial support services. Then we don't have enough of institutional palliative care. Sometimes we also have, let's say, private nursing houses that don't offer the same level of quality of services, and they may be pretty much more expensive than public ones. So we see a problem here as well. So we are not against, let's say, a public sector, but it has to be somehow equal. Then neglecting the role of the older persons in decision-making about their future. Okay, if we are speaking about the dementious people, they cannot really decide about them, but many of them are maybe disabled or whatever, and they still can decide, let's say, what they want to do. Then we have to really develop more or the existing care programs, and raise awareness on the importance of the correct approach to older people, to their family members, communities, and volunteers, as well as to offer educational programs to children about different life stages and the importance of each of them. Because as we discussed in a workshop last week with the Pensioners Union of Slovenia, we have to, let's say, teach children about accepting different stages of life and respect people. So if they respect, let's say, in the first stage, their grandfather and grandmother, they will respect also other people. That's the basis. Then we also have to strengthen the volunteering programs that are actually many in Slovenia. But maybe we would need more support, let's say, from the public side. And what is the crucial thing that we see is the financial question. We really have to build a strong and healthy financial system that will enable us to build this long-term care system we are building now, and that will be sustainable. Because we have to say, maybe Slovenia in a European frame has a very unique position. 30 years ago, when Slovenia became independent, we actually lost a lot of our traditional markets. And many people had to retire at that time with 52 years, even 48 years in some services, I don't know. So we today face, let's say, the fact that some people through this longevity receive the pension longer than they were working. So it really brings a question to the surface that we need to build on that. And then as the last, this is also important because many pensioners have pensions that are below the poverty line or below the minimum wage. And it is normal that somebody that wants to develop, to offer some long-term care services have to have some finance resources in the back. And these people cannot afford, let's say, basic care in the nursing homes, which don't include any different health services and so on. So this is very important, really. We were thinking also about that problem because it's our help receivers at Red Cross. We have a lot of people that maybe have big houses, that have big apartments, and they live alone for years. So these houses and apartments are too big for them. The market in Slovenia for this housing maybe was not so developed, but we would need to, I don't know, to think about some agencies that would help these people, let's say, to sell these properties and to come to a more appropriate, let's say, apartments. Because it's not necessary that everybody goes immediately into the nursery home or into the, I don't know, sheltered housings. They still can be, some of them still can be independent for a long time. So these are main aspects we see in the Red Cross.
Thank you, Silva. I think that's, and Rosita, I think that's quite comprehensive. Tanya, if I may turn to you, I think in the interventions we had both from Silva and Rosita, I mean the need for an integrated and even holistic approach in addressing issues around the topic of accessing services, affordability and quality of services, ensuring that older people don't necessarily find themselves in poverty, or indeed those who care for older people don't find themselves in poverty later on in life because of missed opportunities, missed labour market opportunities. I'd like to ask specifically, what role do you see for older people organizations and service providers, both like Red Cross Slovenia, or in the case of Rosvita's organization, in helping to share care policies, i.e. to help shape some of the policies you've mentioned in the ACTA, but also importantly, of course, in their implementation?
Yes, well, I think that without the cooperation, or even to say without the pressure of older people organizations and service providers, it would not be possible to formulate national care policies. I think on one hand, some members of older people organization are already users of the services or are future users of the services, and therefore also I don't know if this is the right expression, but they are users professionals. They know their needs best. They know what they need. They know how the services should be to answer their needs. And on the other hand, the service providers are professionals who know their field of work best. They are familiar with the modern guidelines and methods of works. They're in constant relationship with the users. And of course, without their pressure, without their input, it would be impossible to make national policies. Whether we really, I mean, we as the government or as policymakers, we really take in account all the proposals. It's also due to financial framework we have, or the possibilities are. But of course, they are the pressure that keeps the government on the edge and makes the government to put the topic on the agenda all the time. Yes.
Thank you, Tanya. I'm just looking at, I mean, we have a few other things to fit into our session this morning. So maybe very quickly, I would ask Roswitha, I mean, if she could reflect and give us an understanding of some of the key ingredients of a good care system from the perspective of older people. That would allow and enable older people to have a good quality of life.
Yes. Thank you for the question. Yeah, it is the task of states to provide older people with access to the care and other services they needed in order to live a dignified and independent life, and to be able to decide for themselves between the various options available to them. An important principle in this is the dignity of older people who have the right to care and autonomy. The right to care is, among other things, an issue of an adequate standard of living, including the provision of social and health services without discrimination, affordable, and in the local environment. From the point of view of autonomy, however, it is important to provide older people with independent decision about how and where they want to live and the support and care they need and want. Good care system will ensure people are free, autonomous, and independent. In one word, empowered. They will help people feel part of our communities and continue contributing to them as equal members of society whose voices count and are heard. Achieving this should be the end goal of policies and services. In sum, if I have enough time, care empowers, care supports and enables inclusion and participation. As we receive care, we feel better. Care supports us to remain included in the community, contribute to society, and participate. A good care system will provide integrating the elderly into society at all levels, involvement of the elderly in decision-making, people-centered care models, supporting the elderly so that they can continue to live with dignity in their homes, sufficient, adequate accommodation for the elderly, homes for the elderly, quality care and services for all at affordable prices and in the local environments. Thanks.
Thank you, Roswitha. I think very clear and open points there in terms of what's key for older people in terms of care systems which respond to, of course, their needs and which are very much anchored to their rights, their dignity, and of course, equality. Silva, I mean, you mentioned in your opening intervention, I mean, some of the practices of Red Cross Slovenia in terms of supporting older people in the community settings. Could you give us maybe a bit more detail on one specific practice that you'd like to share, which really supports older people?
Yes, initially I would maybe say that, let's say, Red Cross, Slovenian Red Cross offers and develops a lot of activities that somehow supports older people and help them in different fields, but they are maybe not so much oriented into the long-term care. So we have few cases on this field as well. And I would like to present as the first one the lay home care. It is almost 20 years ago when we started to develop, let's say, a program of educating informal carers. Because we heard, let's say, of a lot of problems with older people staying at home, and let's say their family members or their neighbors saw them and they had time and they wanted to help, or even the family members didn't have time, but they didn't have another option, let's say, to give them somewhere, so they have to help them at home. And we started to prepare a program and actually develop the program of education, made a curriculum for educating these informal carers. These workshops actually that consist of 18 hours are intended for all those who do not have a medical education and would like to take care of relatives, friends, neighbors when necessary. They face congestion, lack of knowledge, and adequate professional support. The practical workshop is conducted by a nurse or a community nurse with many years of experience in a lecture hall equipped for this purpose. It is based on a Slovenian Red Cross nursing at home handbook. The number of people in need of care and nursing at home is increasing due to the aging population. Due to various medical conditions, many older persons need additional help and support if they want to stay in their home environment. So let's say in this curriculum, we learn people how really to do everything, from making bed, from helping them out, go to toilet, everything about diets and different other things. And to listen to them, to give them psychosocial support. And they also at the end had exams, which were not like in the school, you pass or you don't pass. Okay, you should pass if you would like to be able to do these services, but this is very relevant. So this was developed in our part of Slovenia. Where I live, this is the northeastern part of Slovenia, but is carried now normally by the largest local branch in Slovenia. This is Ljubljana, and they actually cover 1/8 of Slovenian population. There are also some other local branches that are doing this program, but they are smaller. So this is really very important part of our practice. And then if I mention just very shortly other programs, we started to develop a program of active and healthy aging 2 years ago. This is in frame of this new IFRC strategy 2020-2030 healthy aging. So during COVID, we all had a push, let's say, to do something more on this situation about the care for older people. And so we actually started to develop some didactic tools, which we, let's say, published on internet, which we sent by email, some Zoom conferences, workshops, and so on. And we also started with the first educational courses for our secretaries at local branches. To work on this, this is not exactly the same as lay home care, but it offers, let's say, similar things. Then the third thing, which is maybe very good, is we applied for a tender of the Turkish Red Cross for the assets, let's say, for older people. So we received that decision in September, and we started to develop the program. Let's say that we will work on digital competencies of older people. So we want to offer them for, let's say, different topics, let's say how to order at the doctor, or for some examination, I don't know, and then a banking system, and then how to order food, let's say, online, and also general, let's say, tools on the computer. So as you probably know, we have this thermal resort, respectively health resort at the seaside for youth. and we have a different groups of older people there all the time almost. So we wanted to offer them this in the first stage to include this to staying there, this program.
Thank you, Silva. I think there are some very, very clear synergies between the practical services which are being provided by Slovenian Red Cross and some of those key ingredients, again, that Rosvita would have mentioned in terms of care and autonomy, ensuring independence, and obviously, of course, ensuring that people can stay in their own homes and stay in their communities.
Yeah.
I feel included in their communities. I'm very, very mindful of the time. I'd like to ask very, very quickly, I want to stress all of our three participants, and maybe I'll start with Rosvita. What role do you see for the EU to improve the Slovenian long-term care system? So one sentence and a half.
Thank you. H support us with tools such as metrics to change, which enable the rethinking care. And the EU can play a leading role in inspiring ambitious care reform and bring to life our pathway and vision for care in Europe, supporting assistant work of volunteers, supporting emerging new ideas and innovations of long-term care, defining, harmonizing all types of minimum standards required in institutional age, long-term care at home, and such. Help to recognize and to evaluate the work of family members caring for older relatives with the definitions of possible forms of job of reward. And there are many others, and thanks for the EU and H platform.
Thank you, Rosvita. Silva.
Yes, I would like to stress the financial part, like co-financing in the construction of nursing and sheltered housing homes, and then co-financing for the education of medical and nursing staff, and promotion and development of programs based on an integrated approach in healthcare, as well as recognition of Red Cross national societies as an important partner in long-term care.
Thank you, Silva. And Tanya, I'll leave you the floor.
Thank you. Well, I would say that it seems like the hardest thing in Slovenia case is to do this, to manage the shift from institutional care to the community-based care. I mean, we talk about it, we write about it, but somehow it doesn't really come to reality. So what I would think it would be, we would really need is this kind of support. I mean, in all aspects, you know, how to make this shift and to really move into the community to really to make it possible for people to stay at home as long as they want, because it seems like in Slovenia this is like what the majority of people would like to do.
Thank you, Tanya. I think we could talk at length, I think, on some of the points that have been mentioned by the three of you this morning. I know that waiting in the wings, we have two colleagues from different member states who have been listening. I'd like to call on them, first and foremost, Joaquim Perez from the Spanish Red Cross, and also Jok de Reuter from the age member, or excuse me, from the Older Women's Network, who are members of age platform. Maybe first to you, Joachim, I'd like to know, have you had reflecting on what you've heard from our colleagues speaking this morning, if you can give us a perspective of what's happening in Spain and some of those synergies between the example or the case of Slovenia.
Hello, good morning, and thank you very much. First of all, apology for my English, but it's not very good. I'm sorry. The Spanish Red Cross has an intervention strategy with the elderly whose objective is to improve the quality of life of the elderly in the regains process, reducing identified inequalities. This is important for us. No? For this, we act on 4 axes. First axis, people over 65 with some of the problems identified. First, reduce personal autonomy due to difficulty performing all or some of the basic or instrumental activities of daily life, living in homes that are not easy, accessible, or inadequate to their circumstance, involving mobility or autonomy problems, limiting or hindering the other person's ability to continue leading an autonomous life at home. Second problem, mild or moderate impairment of cognitive function due to lack of the simulation, acquisition, or habits, biological deterioration typical of the age, suffering from a disease associated with dementia or sudden brain damage. Third, feeling lonely or insulated for at least one of these reasons, having involuntary reduced contact with the people in the social network, family, friends, neighborhood, having trouble creating or maintaining with new social network, have access to private activity in society, but had an interest in the mild consideration or explaining their social participation. 4. Alteration of your physical well-being due to one or more of the following problems: inadequate health habits, inadequate monitoring to the medical guideline. Medical guideline understand as going to the health service preventively or when there is a symptom or follow of the instruction of the health professional. Have suffered or suffering or have a special risk of some type of abuse, negligence or mistreat in any of its form, and need support to avoid or overcome the situation at its consequence. The second is people who care for one or more people over 65 and feel overburdened and or have difficulty in the covering work to do. A feeling of physical or mental exhaustion caused by continued care, insufficient information and or skill to adequately take care for one or more depends elderly people with whom their life affects the self-care process effectively. Third is people around 65 years of age who meet one or more risk factors and want to carry out an activity participatory and helping again process that allows them to maintain and improve their quality of life. And the third and the last 4, risings always associated about social factors and the environment of the elderly and caring. Thank you very much, and disculpe my English, please.
Your English is absolutely fine, Joachim, and thank you very much for your contribution. I think there's some clear synergies between what was discussed previously and what you've outlined from your own national perspective in Spain. Now I'm very happy to turn to Yoka from the Older Women's Network and ask her as well to maybe reflect on some of what you've heard from the perspective of what's going on in the Netherlands. Yoka, the floor is yours.
Well, thank you. Well, it was a lot what I heard, but in the end, it comes to client-centered, accessible and good quality health at home and in the institutions. Sorry, my English is also not my native tongue. In the Netherlands, we have a good system. We had a good system, and we changed systems in 2007 and in 2000 more in 2015. And in 2000, we had it all central organized till 2007. After that, home help and went to the local communities with the idea that locally one would be better off that people in the local system knows your need and could have a better view than all over from the delivering from the central way of care. There is, and I heard that we have this care, cure, and also the soft part, but a very important part where it's about welfare. So we recognize the difference between cure, care, and welfare. And care and welfare is locally, cure is central. We are all obliged to pay to be insured. We can choose our company, but the government says what for which we are insured. So the companies had to deliver for cure. So the doctor, the general practitioner, the specialist, whatever, that's all covered by our insurance. We have to pay a certain amount of percentage of money for the rest. That is coming to the local councils. To make it a bit complicated is that district nursing is also from not organized, it's organized locally, but it's paid different. So what we've got is all different kind of money hedges, which makes sometimes it very complicated to find where you have to be. And for instance, if you had home care and things are going worse and you have to go to a nursing home, you will be assessed. After your assessment and the agreement that you should go somewhere else, all you got from the local government is gone. Your assessment then is zero, and you have to wait sometimes a year, 18 months before you can go to the institution. And all that time, like you in Slovenia, we have the family. We have the family who is overburdened as an informal care to take care for what in fact is a good system. So we have a good system, we have good quality of people, but also we have built in a lot of obstacles. Mm-hmm. So it's not only about money, but it also has to do a lot about the way that different providers and coordinate, work together or not. And in 2015, but for the home help and all, in the way it was a very good idea. You do it locally, you supply people with home help, you make sure that they can go out and be part of community, and it's all in the law. But the fact was that too few money was delivered for all what has to be done, because 2007, we had another crisis. Mm-hmm. And then in 2015, all childcare and mental health care came also to the local communities. And sometimes I would say that's a bit too much.
Overburdening of the system. I'm sorry, I have to be mindful of the time. I mean, I think
yes. Yes. So sometimes we can, I would say you can look at the Netherlands as a rather rich and with a good system, but it has its problems as well. Mm-hmm. And well, perhaps in the second term, I can, if you have questions, I can tell something more about this.
Indeed, thank you very much. And I think you touched on again some of those points which were well made in the Slovenian case about fragmentation of service, accessing service, financing of services as well on the community level to keep people at home and ultimately to ensure their autonomy and independence. I notice we have 2 messages, and what I might do is I might ask 1 or 2 of the participants just to give a very quick response, because I'm also mindful of the fact that we have a very important session as well, focusing more on the European aspects of older people and care, in long-term care in general, following this. So we have one question.
Ronan, I withdraw my question. I just wanted to put the aspect on the lifelong. I know we've been focusing now on making sure that, at the older stage that it is, that the quality is there. But I just wanted to remind of the lifelong and really the youth, involving youth in healthy living, and then the lifelong, and then also really underlining the intergenerational. I really have seen the value of that, of really bringing the young and the old together. We talked about psychosocial needs, and really that this kind of interact, and it's a 2-way, it's not a 1-way, it's really a 2-way where the different generations can really, bringing them together can really bring a lot of positive value. So I withdraw. I just wanted to put it on the agenda. So
thank you, Mette. And I think Silva touched on that point as well, if I'm not mistaken, in her intervention in terms of working on this. But it's a point well made on the importance of intergenerational solidarity, particularly when we talk about supporting older people, of course. Then maybe one question we have, well, from Matthias Maucher from Social Services Europe. Maybe Matthias, if you don't mind, I'll just ask the first question, because I think it's interesting, because it also touches on some of the points made by Joka. In terms of the reform of long-term care system in Slovenia, we mentioned the need to move away from institutional care, more into community-based care, more to domiciliary care, and obviously as well to support the development of these community-based services to support autonomy and independent living, as well as psychosocial supports. So the question on that topic would be, what is foreseen in the new long-term care system as to services, financial supports, benefits, housing arrangements, etc. So I might give that to Tanya, if you don't mind, Tanya, in terms of looking at the financially supporting this shift from institutional to community and domiciliary care, and what's foreseen to support that transition.
Thank you. If I understand the question correctly, then this new financial source is going to be the compulsory long-term care insurance that the new law is introducing. So far, we don't have this compulsory insurance. We only have health insurance that is compulsory, and other than that, the services currently are either financed from national budget, either from health insurance, or they're paid by the users themselves. This is mainly in case of the nursery home for elderly. I don't know which is the right expression. So we are hoping that with these new financial systems, and with this, I was talking earlier about the entry, that all the people that enter into the long-term care system are evaluated under the same measures, that we will also be managed to find some extra money, because we believe that now some services are too expensive because they are developing on their own conditions and they are not following the needs of people that are using them. So if this was the question about the financial support, and I don't know, I'm not sure if I answered correctly, but
maybe we'll have the opportunity perhaps towards the latter part of the event to maybe touch base on some of these questions if possible. But if not, for sure we can get in touch and maybe to have more of a bilateral answer. But I think that's your response has been quite comprehensive. All that's left for me to do now is really to thank everyone, to thank you, Tanya, Silva, Rosvita, Joke, and Joachim for your participation in the session. We could, like I said, talk at length on these topics, and very, very important topics as well, both from the perspective of policy making, the perspective of older people, and of course from the perspective of service provision, service development and service provision, and of course service, how we finance these services. But I want to hand over right now to Borja from Age Platform, who will lead our next session. So thank you to all participants in the first session.
Thank you, Roland, and thank you to all panelists. It was, I think, a really interesting discussion. This is what we aimed at. We wanted to know better the case of Slovenia, which holds the EU presidency of at the moment, as you know, get closer to a national case to see what are, there's many similarities and the dissimilarities between the different EU countries when it comes to the status quo in long-term care. And I think it was really illustrative of many of the shared concerns that we see across Europe, and probably many of you could relate. Looking at the case of Slovenia could relate to the cases of your own countries. So thanks for that panel, which in my view also in a way illustrated already a tiny bit how important the role of the EU can be in the field of long-term care. And Maciek referred at the beginning of this conference to the fact that the EU doesn't have a strong competence in the field of care. So we often get the question: so why are you actually active at European level in the Brussels constellation of organizations in this field, which is not an EU competence? And the reason for us is that the EU does have not a legal competence, but does have other kinds of competencies, soft competencies that can really make a difference for Europe's care systems. There is mutual learning that the EU facilitates with its policies. The EU does create conversations between member states, does create the dynamic of peer reviewing and mutual learning between states, and that's really important to improve care systems. It also allows, therefore, some kind of convergence, and we hope this is convergence upwards. There is a dynamic of emulation that can really be very important as well to improve care systems. And the EU does also offer us a platform to exchange, to talk to each other, and it gives us the possibility as organizations of older people to speak to providers of services, to unions, and to work in two directions between our members, telling us the situation in their countries, and us contributing to the capacity building of members at the national level. So the EU does have all this importance when it comes to discussing social policy and more concretely care and care for older people. So that's why we are very happy to have at European level a new initiative, which is the European Care Strategy, which was already mentioned in the first panel, which we think can offer us, again, like a great platform to have more fruitful exchanges on how care should be implemented and developed in member states. And I'm also very happy, therefore, to have with us three panelists who really are at the core of the discussions towards shaping the European care strategy. And let me introduce them to you. We have with us a member of the European Parliament, Frances Fitzgerald from Ireland, a member of the group of the European People's Party. Mrs. Fitzgerald was among the first proponents of a European care strategy, and we believe that the pressure that came from the Parliament to have a European care strategy played a key role for Commission President von der Leyen to propose that in her last speech of the Union, State of the Union speech on the 15th of September. So we are very glad to have you with us, Ms. Fitzgerald. We also have with us Dana Carmen Bachmann, who's head of unit at the European Commission in the Directorate General for Employment, Social Affairs and Inclusion. Ms. Bachmann is directly involved in discussions and in the work of the Commission around long-term care and the upcoming European care strategy. You're at the core of the process, so we are very happy to have you with us. And last but not least, we have with us Mr. James Karabot from Malta, who's at the moment the chair of the working group on long-term care of the Social Protection Committee, which is a committee that brings together ministries of social affairs from each member state of the EU. So thanks to all of you for finding time to join us. So we are really happy to have you with us in this European panel to reflect on the role and the content of the upcoming European care strategy. So maybe to start the panel, I would like to ask to Mr. Karabot about the recent report on long-term care that the Social Protection Committee has delivered. This was published in June. It's a report that analyzes the state of long-term care across the European Union. So it gives us a really great overview of the state of long-term care overall in Europe. So I would like to ask you, Mr. Karabot, in a few minutes. So we really want to keep the answers quite short so that we have quite a dynamic exchange between you. So maybe in a few minutes, what are, in your view, the key findings of the report on long-term care that you have recently published?
Yes, thank you, Boria, for inviting me. We very much speak the same language in this field, so thank you very much, and thank you for, thanks the organizers as well. Well, first of all, the report builds on a previous one, and emanates from Pillar 18, which was mentioned earlier, that everyone has the right to affordable long-term care services that are of good quality, and in particular in home care and community services. So here the message is from the beginning that we should focus on services that are in the community to keep people in the community and postpone institutionalization as much as possible. It focused on 4 main domains: access and affordability, quality of long-term care, the workforce and informal carers, and expenditure, financing and sustainability. So let me recap the key conclusions in 5 points. So first of all, the demand for long-term care is set to rise. And so we need to reinforce its provision, because it is through its reinforcement that will contribute more to social fairness. Secondly, all objectives that I mentioned here are being challenged. So we need to, especially when it comes to long-term care. So these are 4 objectives that policymakers should give particular attention and be prioritized accordingly. Thirdly is the workforce. We need an adequate workforce, and because an adequate workforce is the key to meet the rise in demand that I mentioned earlier, especially if we need to keep standards and high quality care and services. And we know, and even through this report, we confirm that there is a current labor shortage, and this may intensify further in the future. Fourth is informal care. Informal care has been essential in long-term care provision, but this often comes at a neglected cost. So we need to move on from community services are very much praised in theory, so we need to invest more in care in the community, including informal carers. The 5th point is about reforms and the investment needed to, we need to pursue further the investment in long-term care. And also we should build on the lessons learned from the COVID-19 pandemic, including in the report we did an analysis of how COVID-19 impacted on these 4 main domains. An analysis that was carried out across all member states, and we know how these 4 main domains were challenged a lot, especially when it comes to access. Many elderly had their services halted and stopped during the COVID-19. They had to be adapted again. So the quality of long-term care, I mean, was very much challenged during the COVID. So the services that were prepared more faced COVID-19 in a much better way. And that means that we need services that are guided through robust operating procedure, financing, etc. Workforce and informal care. We also we are noticing a shift now. People are demanding more to stay at home. So there was a shift that people opt to stay at home rather than to go to an institution. But this has been reinforced much more during COVID-19 because of what happened in some nursing homes, because what happened during the pandemic. And fourthly, the expenditure. Expenditure rise during the pandemic, of course, because of many adaptations in the community and in institutions. So we need to, as I said, to furthermore our investment and our thinking in long-term care, because it is through long-term care that we can also, first of all, as I said, keep people in the community. But from a financial point of view, of course, we may contain pressure on acute care, pressure on long-term care services.
Thank you, Mr. Karabot, for trying to make a summary out of a very dense and very complete report. I will turn myself to MEP Fitzgerald, and again, thanks for being with us in this hectic week of plenary, actually, which is hybrid, which allows you to be with us very luckily, and we are very happy about that. I mentioned that you were among the first proponents of a European care strategy. You've been fighting hard for that at the European Parliament. So my question to you would be, what would you like to see in the European care strategy? We just heard the situation in Europe, some of the policy areas where action will be needed. What's your view on the content of the strategy?
Well, thank you very much, Börje, and good afternoon, everyone. Delighted to be on this panel with James and Dana, and James has addressed some of the issues already. I do agree with him that COVID-19 has given us a new lens on care. All of the issues were there beforehand, but I think it's a very opportune time now, given that new lens that we have, and the importance of care. But it's not enough to clap on the streets. We really need to, build up policies across Europe. We share a lot. We have a lot in common in relation to this issue, but we need to do far more work to get a European perspective on this. While, as you said yourself, Börje, national competence will always remain. But I think there's a lot we can do at European level. Yes, I lobbied hard for this with President Ursula von der Leyen, and I was really pleased that she included it as part of the Commission's work stream for next year. I think that's going to be absolutely important. I think care is one of the cutting edge issues of our time. It's linked to quality of life in a younger and older age. It's linked to gender issues, overall equality issues, quality of life, and how we build community. So it's a very cutting edge issue. And there are many employment issues in relation to it as well. It's how you recognize the voluntary and and also the professional sector. It's a combined approach we need to put it all together. And there's 5 areas I would highlight where I think a European care strategy could play a part. First of all, we've got to collect and access the data. We actually don't know what's happening across Europe in terms of care, about the carers and those who are cared for. We need to get much more accurate data about how different member states approach the care issue and the different needs. So I think Europe is brilliant at gathering this sort of data. And I think once the focus is there from the European Commission and with the Parliament support, I think that would begin to sort of give us a pathway forward. So that's the very first point. Secondly, I think we have to look at the whole question of boosting gender equality and work-life balance. Let's face it, we know that care is almost, very 80–90%, it happens to be done by women. That's not to say there aren't many men doing extraordinary work in caring, both in an informal and formal setting, mostly informal, I would say. Now, we need to look at work-life balance, because once you start looking at work-life balance and you look at the care demands on particular women and men, but women primarily, you begin to see then how impossible it is and very difficult to have a work-life balance when you are perhaps working outside the home and caring, or you're caring full-time inside the home, becomes impossible to work outside the home. So I think, there are poverty issues here as well, because you have a 14% gender pay gap and you have a 29%, just think about it, a 29% pension pay gap across Europe. So that means the risks of poverty in older age are quite high for many women. And we really need to be examining this, because that impacts on quality of life at a later stage, how you get the money to pay for services, how you run your own life as a carer and the demands on it. So that's really important as well. Third area, we think that there's great opportunity here economically in terms of creating jobs across Europe. The potential is for about 8 million jobs. Now, we've got to look at visa issues because we've many migrant workers who are doing care work, often in the Black economy. We need to examine on this. We need to be improving the training, the status, the employability, and the support systems. I've seen in Ireland, I'm by the way, an Irish MEP from Dublin. I've seen how if you build up training and supports for childminders, how that can really help the quality of their lives. I think we can do the same with care workers across Europe and build up more supports for the care workers, as well as creating better employment opportunities. So that's a big area that we need to be looking at, the whole economic potential there. And that will help everyone, actually. It's about the development of skills, because this is skilled work. Fourth, the use of EU funds. I was very keen to see that huge money, greater than ever before, that's been given by Europe to member states, billions, I mean, huge money. We've got to make sure that some of that is used for a care infrastructure. And we need to demand that of member states to make sure that the care infrastructure is built up, whether that's actual buildings or supports or training. We should be using some of that money, and the EU should be insisting on that. And if you start using the budget in a gender sensitive way, and you start doing gender budgeting, this is an inevitable outcome of that, and it has huge potential. And fifthly, I would say, if you've got to measure things. It's very important to measure what's actually going on and set targets. So I think we need to set targets and high and ambitious goals to progress our care priorities across Europe. We have fantastic NGOs in this area, have been doing amazing work. We have fantastic informal carers. We see it here this morning, and thank you for organising this workshop on this important topic during the presidency. I think we need to set Barcelona targets, like we did the Barcelona targets on childcare. We need to do the same on care generally. And we need to do it across all care priorities. So I believe that there's a lot we can do with a European lens. But of course, the member states have to get on with the work then and make sure that it's taken seriously at member state level. It's too easy to rely on what's happening already, but there's a huge cost to that. I mean, both personal, psychological, social. So we've got to move it on. And I think now is the post-COVID is the right time to do it. And there's a lot of potential here. And I think we all have to work together to make sure we reach that potential. So there's some of the key points and the key areas I would see huge opportunity in across Europe to collectively address this issue and bring that European lens to support and to inform on the issue of care. Thank you.
Thank you. Thank you, Ms. Fitzgerald. That was a very comprehensive presentation of some of the key points, and we really share them. You refer to targets of access. That's for us something we should really develop for long-term care, as well as we have them already for childcare. So we think that can be a game changer in terms of ensuring access to formal care services. So really, we really share those points. I'd like to turn myself now to Dana Carmen Bachmann from the European Commission. And I know we've been asking you a lot, what are you working on and what are your plans for the European care strategy? And I know that work is ongoing. We are still at the early stages of development of the care strategy. But I would like to ask you, what are your goals in the European Commission for the care strategy, if you could present them in a few points?
Yeah, so many thanks, first of all, and very happy to be here and also listen and learn a lot from the discussions earlier. So I would like to say indeed that for the long-term care, for the care strategy as such, the goals are very simple, and that is to really ensure that everyone in need of care, no matter at which stage of their lives it comes, they have access to services which are of good quality and are affordable. So it's a very simple goal. It's very clearly stated in the pillar of social rights. And this is the overall really big objective, not easy to achieve. On the other hand, maybe what I wanted also maybe to go a bit more into details was to say that when we talk about the care strategy, we are not starting from zero, because indeed we have had many strands of work. at European level, maybe much more advanced as regards with early childhood education and care. I mean, the Barcelona targets, but also recent initiatives within the European education area and so forth. And in long-term care, I have to say that indeed we have focused our attention mostly, if I look at the points mentioned by Mrs. Fitzgerald on first and fifth point. So data collection, improving the analysis, the evidence, and really fourth point, and channeling funding for broad range of measures. And I think with the care strategy, there is an opportunity to connect many different strands of work and bring them together into one coherent vision in terms of what do we want for our citizens, for everyone living in Europe, what kind of services they should have. Which is why maybe I also wanted to highlight that in the care strategy, we want to bring in the two dimensions, the dimensions of the focus on those in need of care, but also the dimension of those providing care, both informal workforce and informal carers. Now, maybe a bit to the specifics for everyone to understand, because the Commission likes to make things complicated, but maybe they are not so complicated. So the care strategy, indeed, in terms of how it will look like, we are looking at the Commission communication that will cover horizontally early childhood education and care and long-term care. And then it will also have proposals, one specific proposal for a council recommendation on long-term care, and also a proposal for the revision of the Barcelona targets. I will really zoom in on long-term care in my intervention. We work very closely with colleagues in DG Just, because they will be leading on the early childhood education and care. And of course, we are strong partners in delivering of on the care strategy as a whole. Then also what I wanted to say is that both, I mean, the care itself, and it has been highlighted by the other speakers, it is very much ingrained in our society. It's a vital part of our society. It impacts everything around us. It impacts our family relations, gender equality. We have large workforce, so care as such, it's a very large sector, but also with much bigger growth potential. It impacts the values, the human rights, and so forth. So there is something going through all the aspects of our society, which is why we need to, in developing this initiative, to build those links to disability strategy, to working conditions, skills development, to name just a few. I also wanted to highlight that when we start the work on the initiative, we have few, let's say, basic assumptions. We have the challenges of the long-term care very well spelled out by jointly by the Commission and the Social Protection Committee, and James explained it very well in the report on long-term care. We also have the momentum of the COVID crisis, and I think we all knew about those issues. It was just, they were made much more blatant, and they somehow also probably helped trigger debates at national level. So that's also quite important to say. And we have a lot of contributions that we have received through the public consultations or on the Pillar Action Plan, Green Paper on Aging, but also when work was done in developing the gender equality strategy. So I think it's really quite a good starting point, because also there is a very shared understanding and transparent understanding of the challenges with the member states. We have also seen the Slovenian colleague really giving a very honest and self-critical vision of what are the main challenges at national level, which I think are very much echoed across the countries. And with the initiative, we'll also aim to address these two levels, because there is the European level, and indeed there is a lot of potential in terms of what could be done at European level, especially also in helping trigger policy reforms that go towards a coherent vision of what should be a quality long-term care system. But also through the proposal for council recommendation, the idea is also to give incentives, messages in terms of things that should happen at national level, where those in need of care and those providing care are. And we would need a lot of solutions very much ingrained in the local context and local communities. So that's as a start for this part, and happy to add on later. Thank you.
Thank you. Very, very good points. I keep that you said care is vital, and that also resonates with what MEP Fitzgerald said about care being also an opportunity, also even economically being an opportunity, socially it's also an opportunity in terms of gender equality. And that's for us, H Platform Europe, that's a key point to insist on the fact that sometimes, I mean, too often we approach long-term care as a problem, and the challenges are there, and of course they are big. But it's also an opportunity for people to live better. It's an opportunity economically in terms of gender equality. So we should really, we think the EU can have an influence in how states are approaching long-term care and creating a different kind of, if you like, music around what care is, and that care is also an opportunity and a solution for people to live better. So thanks for those points. I am aware of time, and I know that Mr. Karabot has to leave very soon. So maybe if you have 2 minutes, James, I'd like to maybe ask you a reflection from your national perspective as a national policymaker. What do you think member states? How do you think member states can actually? I mean, do you think they will be very, let's say, reactive and open to implementing the care strategy? Do you think this will really make a difference for national debates and national policy making? And what do you need in the strategy to make sure that's really the case? How the strategy can best help you at the national level?
Yes, I think we need elderly people to be engaged in this process. So I believe in co-production in the sense that we need to formulate policies not on our own, but including service users, because it is through this that we stop to be reactive in this sense and be much more proactive. So we need to spend time to listen to the elderly and what are the needs and their aspirations to keep on helping them in the community. I also think a good practice in my opinion is to involve stakeholders, not just in the consultation, but even in the care provision. Persons' needs are quite complex, so it is very difficult to get one service provider meeting all the needs. So I believe in a welfare mix type of service provision. So it is not just the government, but also the family, the NGOs, private sector, friends. So we need to make this sense of social support, a social capital. These relationships in the community coming from formal services, but also from informal services, that are working together in order complementary to each other, okay? Because when one service cannot meet a particular goal, a particular need, you have another one complementing each other. I believe this is the way forward. So but eventually you need someone to coordinate all this, if the elderly can do this, then it is the role of the state, of the government, of an NGO to do this. It depends on the system, how it's set up in that particular country. Because we know even from our data that 1/3 of European households that are not using professional care right now, they are reporting financial problems to access service. So, and that is why I reiterate the importance of a welfare mix to improve as much as possible the notion of accessibility. Workforce. I cannot, it's very important. I cannot leave out the issue of workforce. We are seeing an unprecedented shortage in this. We cannot have good community services without proper carers that are well trained. Countries should have a structure for getting carers in the community. We have many, from what we learned, is that we are focusing most of our energies to check and do quality audits within institutions, but within community care services, what is happening within the households in the community, I think we need to strengthen more that area. We need to check what is going on there. We need to beef up more the quality audits in that sense. So I think governments should invest more, even financially now. I mean, we know that within the next, by 2050, I wrote this somewhere, yes, by 2050, the 2.5% of the European GDP will have to increase to dedicate to long-term care. So we need to do this diligently in a scholar way. And to do this, we need data, we need research, but above all, we need to listen to the elderly themselves.
Okay, thank you, James, for all those points, which are really good. Involvement of users, that's something we will always be insisting a lot on, the fact that organizations of older people should be part of discussions on national level. For us, that's really great that you highlighted that, because we always ask for that. I'm a bit in the same sense. I'd like to ask Mrs. Fitzgerald. So once the strategy is out, we have seen other European strategies, and we know that sometimes implementation is not consistent, or at some point the strategies may be forgotten. I was just wondering, what do you think would be the role of the Parliament, and how we can partner with you to make sure that once the strategy is out next year, there is proper implementation of the strategy and proper follow-up to it, so that really has an impact at the national level?
Yes, you're talking about once it's out. Let me just make a very quick point, Boria, about before it comes out. I remember when I was in government in Ireland, people saying to me, someone said to me once, when you're in government, you think a lot of the power is outside. And when you're outside, you think a lot of the power is inside, as an NGO. And I come from an NGO background. And I think really it's about partnership and bridge building. And I think there's a real opportunity here for the NGO community who are involved in care and the voluntary and professional organizations to really impact what's going to be in this care strategy. And I think that's really very, very important. Bring the experience on the ground to the table of the Commission, and make sure that we have a strategy that reflects the reality. And you've heard about the budget, that's going to be needed for long-term care. We've got to make sure that's there. And as I say, I see it already across Europe, the shortage of care workers. Very, very serious issues. And we need to be imaginative around this. We need to have streams, as I say, justice policy needs to look at this as well. In terms of visas, it's really important. We're going to be recruiting both inside and outside of Europe, and we need to really open our minds in relation to this and provide the proper opportunities for people. So I'll say that first. And link, with the commissioners who were involved in this area. I think it's really worth reaching out to all of the, commissioners, Commissioner Daly as well, Commissioner Soika, and, the relevant commissioners. I think there's a great opportunity there, and they're very interested, as is Ursula von der Leyen. So once it comes out then, and that's a little way forward, I think really important get engaged at this point, right? I have to say that again. But I think once it comes out, I think Parliament has a role monitoring, as we do, the implementation of the work-life balance, budgetary spending, such as on the, the Recovery and Resilience Facility. And I think, it's about ongoing engagement with the commissioners, much like we do on any strategy that you have. It's always there. I mean, I've done a lot of work on childcare myself. I've seen over the years how it's improved. You've got better standards. You've got more money. You've got a wider group that it's reaching out to. I mean, fantastic energy coming from Europe in relation to childcare, but still a long journey ahead. And it's the same with the care strategy. You know, we're at an early stage, I believe, from a European perspective in relation to this. Quite a journey ahead. So the the first of all is getting the right base and getting that what's in the report to be absolutely relevant, and then the monitoring. And I really would say it's about that strong engagement between the NGO community and, the institutions, the officials. I think we've got terrific officials who are working on this and who are very committed to it from what I've seen already. And I would be very optimistic that, we'll get a good groundwork being done in the next, year to two on this. And then it is about the monitoring, the implementation. But of course, I'll finish on this. It's primarily then about the member states taking this seriously, pushing it up the list of priorities. Hard enough to get it up the list of priorities in member states, even though it's such a pressing need, because you can see the pressure that's on health budgets with COVID. We can see the problem with services in the community now. We're at a very tough time when it comes to prioritizing these care services because of COVID, competing demands, pressure on our health services, and so many people getting sick, I would say, with so much false information out there. I'm on the Committee on Disinformation in the Parliament. I'm very concerned about this in relation to the vaccines, what I hear being spread and the low vaccination rates. This has implications for what we're talking about here today, because you only have so much budget, so much resources. So these things are not separate. They're all linked to the challenges we're facing as a community at the moment. But look, as I say, the committees will be following the care strategy as well. The Social Affairs Committee, the FAM Committee, of which I am coordinator for the EPP group, and I've written a report on care for our own EPP group, and we are prioritising it within the EPP group, and I want to see that spreading right across the Parliament. So, as always, there's a role for the Commission, there's a role for the Council, and there's a role for the Parliament, but it's a challenging time. But we really have to do this to give quality of service and access to services for our citizens, because, if you're talking about childcare, we need childcare. Working from home is no excuse. It's not an alternative for childcare. Let's remember that. It's not an alternative. You still need childcare. Like with elder care, we really are going to need more community care for our older citizens. And if we don't, you're going to have increased costs on our health services as well. So look, I think there's plenty of work to keep us all quite busy in the next while, and to have far more of these meetings bringing everyone together. So thanks again for the invitation to be with you today.
Thank you, Mrs. Fitzgerald. You highlighted the challenges ahead, but you were also very hopeful. I think you really gave us some energy and positive energy about all the potential the strategy can have, and the importance of reaching out to you, to the European Commission, to work with officials. This is the moment indeed. We don't have to wait for the strategy to be out to then push for its implementation, of course. We are really short of time now, so I'd like to give the floor to Eurocaters, to Stacey Gimonos, Director of Eurocaters, who's a great partner of Age Platform Europe and a very visible actor in our debates around care at European level. Informal Carers, many of you have highlighted that, are key stakeholders in our discussions. So we would like to hear from you, Stacey, how you are actually approaching the European care strategy. We would like to see what you would like to see in there, and how you think you can best engage with the European Commission, which is also something I'd like to Dana to tell us about. So how civil society can really actually work with you in the coming months to shape the care strategy. So Stacey, you have the floor.
Thank you, Borja. I hope you can hear me. Thanks a million for giving me the opportunity to intervene during this very interesting event and to bring the perspective of informal carers. So yes, in our view, the EU care strategy is not only an essential tool to try and address the growing care needs of the European population, but it's also an opportunity to redistribute caregiving responsibilities in our society, or at least to try and strike a more adequate balance between professional and informal care. I guess, I looked at the list of participants. I saw a lot of familiar names. So I guess many of you know by now that the bulk of all long-term care in Europe is actually provided by informal carers. It was mentioned by several speakers earlier. And this reliance, or I should say over-reliance on carers, generates unequal systems across Europe, because obviously, first of all, not everyone can rely on an informal carer, but also because when informal carers are not adequately supported, and unfortunately, that's often the case, well, these people face a long list of challenges in terms of access to education, employment, in terms of poverty, social exclusion, or negative health outcomes. So this needs to change, and we need to ensure that alternative solutions to informal care exist across Europe. And we need to start, of course, with investment in good quality professional care, which is and should remain the foundation of universal care. The way we see it, informal care should supplement professional care, not the other way around. So in that regard, I can only repeat some of the points made earlier by previous speakers, that we need to introduce EU-wide indicators, but also ambitious targets in terms of what we want to see across member states. Something along the lines of the Barcelona targets in the field of childcare would be great in the field of long-term care. We also need to support the development of integrated community-based services, because the lack of such services is at the source of many of the challenges we face in terms of quality and access. And when it comes to informal care, it is clearly one of the predictors of the prevalence of informal care, or at least this approach that informal care is the default option for the provision of long-term care. And then last but not least, when it comes to professional care, we need to define a quality framework, a vision for long-term care, which is rooted in human rights and dignity for care users, but also for carers. And there the key word is co-production. So we need to involve care users and their carers in future discussions. But this is only one side of the coin, of course, because whether we like it or not, informal care, again, from our perspective, is here to stay for various reasons. First of all financial projections demonstrate that, at least in the foreseeable future, it's going to be extremely difficult to replace informal carers by care professionals. Secondly, because the declining pool of carers we keep reading about in pretty much all EU publications on the topic, actually does not mean that informal care will disappear, particularly if there are no alternative solutions. It actually means that informal carers will face more and more challenges, and that more and more of us will have to combine caregiving with social and professional responsibilities. And then thirdly, because caregiving is part of the human experience, and it should also be mentioned that it is also a driver of social cohesion and intergenerational solidarity, which was also mentioned earlier. So we cannot only approach informal care as a barrier to a productive life. It is also part of what we'd like to see and nurture to some extent in societies, in the future. So here, when it comes to informal carers, well, what we would like to see in the care strategy is, well, at least we hope that the strategy will contribute to the development of a legal status for informal carers across Europe. I think it's high time carers were recognized for what they are, partners in care, and that legal status should give them access to rights. Again, some were mentioned: access to social protection, financial support, pension, respite care, information, training, and so on. But also obligations to monitor that the quality of the care they provide is, up to certain standards. By the way, this idea of a legal status for carers may sound far-fetched, to some policymakers. But actually, when those of us who are familiar with the Work-Life Balance Directive know that the transposition of the Work-Life Balance Directive and the rights for carers to a carer's leave actually means that we now need to define, legally speaking, what informal care is and who informal carers are, across all European countries. So the tool is there already. We just need to use it. The gender equality dimension of informal care is indeed a crucial issue that needs to be addressed in the future. And there again, we need to encourage the equal sharing of care responsibilities between women and men. paid leave is extremely important in that regard, and ideally that leave should be paid at a high level to enable the higher earner in the household. Unfortunately, usually that's the man to take the leave, not just the lower earner. Flexible work arrangements to allow for two-earner household, and care credits for social protection. I know recently in FEM committee hearing, Commissioner Schmidt hinted that that's potentially one of the measures on the table, and we very much obviously support the idea of pension credits for carers. And then finally, yes, we need to better monitor the prevalence of informal care, as well as the negative impact associated with the lack of access to good quality professional care on both users and carers. So as you can see, we put a lot of hope in the care strategy, and we hope we're not going to be disappointed. But I think planets are aligned and the context is right for the care strategy. And obviously, as you can imagine, we'll do our best to inform the process. So thanks a lot for your attention and for the invitation.
Thank you, Stacey, for those great points with which we agree from age, certainly. Before I give the floor for the wrap up to our last speakers, I'd like to maybe ask Mrs. Fitzgerald and Mrs. Bachmann if they have any last remarks, 1 minute max, please, before we end this panel. Mrs. Fitzgerald.
Well, thank you. Look, I think you've had a very comprehensive discussion on the care issues. I mean, this is an important time to try and make a quantum leap forward in relation to care. I think it doesn't often come around. It's also a very challenging time to do it, but opportune as well. So I think it's about us making sure that we get a really strong care strategy from the Commission. It's really important that the Commission reaches out. I know they're going to do that. And that we then, I emphasize again, the work of the member states and, getting ministers engaged on this, health ministers, social affairs ministers, making sure that in each of our member states, we work to make it a priority. In Ireland, I've recommended a care commission. I hope that will happen alongside the care strategy being developed in the commission. That might be an idea, but each member state needs to prepare for this strategy, highlight the fact that it's coming, and really, I suppose we'd say up the ante on the strategy, because it's critical for all of the reasons that have been outlined here today. Quality of life, particularly for older people, and also throughout the life cycle. Thank you very much again for the invitation.
Thanks to you for having joined us. Thank you, really. And Dana?
Yeah, so maybe on my side, just to pick up quickly on the issue of dialogue and contributions. And I think really the fact that we are engaged in many of these type of meetings, that's precisely not only for us to talk, but to be very much in the listening mode and to see what's coming out as proposals. And I think we start already receiving many contributions, position papers from different organizations, plus all that we are building from the public consultations. Maybe also to say that we are indeed going to publish a call for evidence, so which should underpin all Commission initiatives. And of course, there will be a formal process for submitting contributions, but I think this dialogue in this type of meetings is also very helpful. So we will do those in parallel. Maybe one thing that I wanted to keep in mind, because indeed for the strategy, and I think especially with the strategy, we could have in it things that look at what the EU level could do, some messages in terms of what member states governments could do, but also quite important calls for social partners, civil society organizations, providers of care in terms of how they could get engaged. So I think it's important also to keep in mind that not everything that I have heard in terms of wish list could be on the shoulders of only one institution. Maybe I also wanted indeed to pick up on the implementation, because I think that's quite important. And it's also maybe in the design of the initiative to keep in mind that we need to have a vision that is ambitious, but it's also, I mean, there is a way to put it in practice, so you don't discourage and you get the feeling that it's impossible because there are so many things to be done that we don't know where to start. So I think it's important also to keep that in mind, and maybe also to reflect in a previous initiative on which I worked in the past. It was very helpful to have the MEPs involved, not only in terms of monitoring at EU level, but also in terms of going within their constituencies and mobilizing actors at those levels. Maybe another point that I wanted to touch is on the issue of targets. I think indeed there are many calls within that respect in the long-term care. Nevertheless, I wanted to say we have a completely different starting point with the early childhood education and care. So we are really now building up indicators agreed with the member states and trying to, let's say, see among the many different types of statistical data sources that we have. They all come with different definitions, different angles. So it's not a straightforward exercise as it will be, as it is with early childhood and care. Maybe my last point indeed is to keep in mind in your contributions that we very much welcomes ideas also how to operationalize some of the concepts and some of the principles that should be behind the care strategy, because I think we are very well in terms of the policy vision. What we need much more, it's also actions to which this vision could be turned into reality. And otherwise, really happy to work together and to receive ideas, suggestions on your side, because we are very much in this reflection and listening mode. So happy to get to know much more than we know now. Thank you very much.
Perfect. Thank you. And thank you for engaging with us in this workshop, which is a proof that you really aim to reach out to us, to civil society, and have these kind of exchanges. Thanks a lot for that. Thank you to panelists. Thank you to Mrs. Fitzgerald, to Mrs. Bachmann, also to Stacey. And thanks for the very good panel, very good contributions. I'm closing here the panel because we are running really out of time, and I would like to give the floor to Silva Du from the Slovenian Red Cross for final remarks, who will be followed by Jušica Puhar from the Slovenian Federation of Pensioners Associations. So Silva, you have the floor now.
Thank you very much. It was very interesting what everybody presented here and what we could hear. It is really very good that we have this exchange of different practices, needs, visions, and everything. So, do you see me? Do you hear me?
Yes. We can hear you very well.
Because I had some text on my screen, so I thought you don't hear me. Maybe I will just make it shorter than I wrote it. I presented, let's say, what we are somehow doing on the level of the Slovenian Red Cross. I would also say that a lot of things that we are doing now, respectively, all of the things that we are doing now are on voluntary basis. Red Cross of Slovenia is ready, let's say, to perform also the education for formal carers or also informal carers as we do now in the future, but not only on voluntary basis normally, because we have this authority, public authority of first aid courses and first aid exams for different groups, and we also train, let's say, in 70 hours courses the medical staff which are members of first aid teams. So we could do it here on the similar way. Yes, regarding now this new law on long-term care in Slovenia, we would like to stress that maybe we rush too much with this process and we don't include enough of different stakeholders into the wider discussion. So Red Cross is not, let's say, actually involved in these discussions with the government, but we can see and hear let's say, messages of all the other organizations that are actually and actively included in this. And it would be important, let's say, to listen to everybody, because as Mrs. Fitzgerald said also, we have to prepare the laws before we adopt them. Not that we adopt something that is not completely, let's say, prepared and doesn't cover all the areas. It's better to wait a few months more, include all the stakeholders that are important. Yeah, and we see also the fact that more people would be employed in this long-term care as very important field, and they should also be paid properly, because they are not. We hear a lot about this, that people are leaving, let's say, nursing homes because they are underpaid, or nurses are leaving hospitals because they are underpaid. This could help grow economy actually, and help combat the unemployment. And we really appreciate this opportunity today, because we see this as an opportunity, let's say, to exchange our opinions, to widen our views, to widen our horizons. Thank you very much.
It's your turn. Yeah, Josica, can you hear us?
Okay, it's okay. Hello, all again. It's a very short passage of time which I have on this disposal. So I would like only to mention some important points of our situation in the moment. When the law is passed, many provisions will not be able to be applied immediately after entry into force. Implementing rules, organizational changes, and operationalization of the funding system will be needed. According to the text of the law, some provisions will only be able to be implemented in 2 years. Our reality now, after waiting to get the law, is therefore to pass it, but implementation will be gradual. The government is just working to improve the situation in praxis, which was mentioned by the representative of our ministry, especially in terms of capacity, salaries, employment of the whole staff. The government is also expanding the granting of concessions. The prospects for the employment are also in Slovenia not very high, but very lightened, because there's a shortage of suitable working force. Nevertheless, in Slovenia, trainings are underway. People expect that the law will bring the accessibility to the home care and also the institutional care. People would like to be at home in the last part of their lives. Nevertheless, a large number of applications for admission to institutional care we still have. People wait that the regulation will be so that they have the equality, better conditions, and equal treatment in all the modes of long-term care. I'm not able to repeat all the similarities which I noticed in your presentations, and I hope all the things which connect us all over the Europe, all the states, all the people, all the organizations will be included in the conclusions we will spread at the end. I would like to stress only what we still wait from the European Union. We would like that the strategy will achieve the placement of long-term care issues in EU countries at a higher level in the range of their priorities. I understand that we support the solutions and current actions presented from the side of EU representatives in today's workshop. We also support the reforms in social system, and we expect that EU will support such reforms. We expect that the EU will draw attention to the urgent applications of principles such as equality, non-discrimination, autonomy, citizenship, participation, and inclusion in the normative basis of care and support. We also wait and we are sure that EU can support our wish that all the people will participate in all the decisions which affect them. I would like to finish with the results of our conference last week. It was very interesting, tackling long life approach to aging and ageism. I hope that you will have the opportunity to read later in the conclusions of this conference, which is also very close connected to long-term care. And before ending, I would like to say that the Red Cross and Age Platform will share messages with the participants of today's workshop that will be able to influence the European care strategy. Through this and other joint actions, we build understanding between different organizations and create the image of long-term care as we image it concerning what is needed for people. I would like to thank for the idea that the Slovenian case will be on the agenda of today's workshop. I would also like to thank for the invitation and also to the members of AGE and their secretariat to invite us to be part of this workshop. I hope I can thank also, I can say thank you to all participants. You have done a great job and you contributed a lot of also for the use of the preparation of the strategy on long-term care from the side of European Union. Thank you very much. I hope with this, the session could be closed.
Thank you. Thank you, everyone. Bye-bye, and thank you, everyone.
Bye-bye.
Bye, thank you.
Bye, thank you.
Bye-bye.
Bye-bye.